The number of coronavirus cases worldwide now stands at more than 29 million. More than 924,000 people have died. This follows a record daily increase in global cases over the weekend. According to the World Health Organization, more than 370,000 new cases were recorded in just 24 hours Sunday. Though cases are trending downward in the U.S. and Brazil, a Reuters analysis finds infections are still rising in 58 countries. A new article by the New York Times explores the other killer connected to COVID-19, hunger. According to that report, hundreds of millions of people around the world who went into the pandemic already suffering from extreme poverty are now faced with an intensifying crisis. The number of people in the developing world confronting life-threatening levels of so-called food insecurity is expected to nearly double this year to 265 million. Joining me now from London is Peter Goodman, the New York Times global economic correspondent. Peter is one of the authors of that article. Peter, welcome. Thank you so much for being with us. Your article focuses on how the pandemic is exacerbating this already existing problem of food insecurity. Can you explain what that means and which parts of the world are most vulnerable right now?
Sure. So typically, anywhere you have large numbers of people who are poor, whose incomes are not assured, and who then face some kind of trauma, an environmental crisis, armed conflict, are at risk of serious food insecurity. Not simply going hungry, which is a serious enough problem and a problem that affects hundreds of millions of people around the world, but getting to the point where they simply cannot provide day to day for the basic nutritional needs of their families. And these are people who are typically in the poorest countries to begin with. So, our story focused on Afghanistan, South Sudan, but really much of South Asia, much of sub-Saharan Africa, in places where people were already living in challenging conditions of poverty, where they faced especially the risk of conflict and environmental troubles. And you layer on top of that a shock like the pandemic, which makes it very difficult for people to move around, which shuts down markets, which shuts down farming operations. In some cases, it disrupts the supply of food, though largely we found food is widely available, but it significantly hits people's livelihoods. I mean, if your job was moving goods around on a wheelbarrow, which was the situation for one family we focused on in Afghanistan, and the market shuts down and there's no longer demand to move things around, well, incomes plunge close to nothing. And suddenly people who were barely getting by are now not able to feed their families.
Peter, within these impoverished regions, people have normally been able to rely, at least in part, on some help from structures that provide access to basic dietary needs. How has the pandemic impacted things like schools and relief agencies?
Yeah, that's a really important dimension to this. I mean, in places where people are afraid to send their children to schools, which is a lot of the globe, or in places where there are school shutdowns, and of course these are overlapping, you have disrupted a major source of nutrition for lots and lots of children. In places like India, Bangladesh, Pakistan, much of sub-Saharan Africa, the meal that children get in schools is the only reliable meal they can count on. And with schools now shut down for months at a time, a lot of kids are going hungry that way. The other thing is a lot of kids get immunized at schools. They're given deworming medicines and other public health campaigns that limit their vulnerability to disease and that limit their vulnerability to malnutrition. So a lot of that's disrupted. Outreach workers are either afraid to go venture into communities, or the communities themselves are afraid to let outsiders in. People who are in need of serious medical attention for kids who are very seriously malnourished are afraid to venture away from their villages and into cities, because the word is out that this pandemic is real and it's serious and it's a killer.
And Peter, another factor you explore is how the crashing economies in bigger cities is causing rising hunger, but the demand for food crops has actually gone down. Can you explain that paradox?
Yeah, I mean, it's a very complex set of factors. And you're talking about the global economy, and there are differences from place to place. But one thing that's happened is that as people have lost their incomes, so take, a giant city like Mumbai or Delhi in India, as people have been unable to get to work, as the government has imposed lockdowns, but forget the lockdowns, as people are afraid to venture out to markets and buy things, people who sell things at markets have lost their incomes. People who run small shops have lost their incomes. And so that's translated into seriously cutting what they're spending on food. So families that might have once spent for meat or fish are now down to just rice and bread. They're cutting even, bean consumption, greens, fruits and vegetables, of course, cost more money than generally canned products or simple starchy products. So the result of that is a lot of farmers are discovering that in the midst of a pandemic where an awful lot of people are hungry, there's actually been a tremendous loss of demand for their crops. So in India, for instance, a lot of laborers are themselves suffering because farmers are discovering that the prices for some of their crops have fallen so low that it's not even worth paying people to harvest them, and the laborers aren't getting any money, so they're themselves economizing on their diets, which is perpetuating this. On the other hand, in some places, you've seen food shortages, or not just shortages, but food prices surging just as people are losing income, because in places like East Africa, where food tends to be delivered by truck, there's been a lot of disruption, borders closing, lots of new COVID-related checks. It's really a complex mix of factors that has disrupted people's access to food.
Right, and of course, as you pointed out earlier, there's plenty of hunger right here in the U.S. Unfortunately, we've run out of time. We can't get to that element of the conversation. But Peter Goodman, thank you so much for joining us.
Thank you.